is a very interesting case. It's a 42-year-old individual who obviously presents with symptomatic hyperviscosity, and it's important really to understand that this is an oncological emergency. The patient is relatively young, for presentation with Waldenström's, but his case is quite extreme. He's presenting with an extremely high IgM level, and his symptoms are very much in line with symptomatic hyperviscosity. So, from the get-go, one needs to look at this as an oncological emergency. Also, what makes this case kind of interesting is that the patient also presents with bulky adenopathy, and this is extremely important because as you're thinking about how you're going to manage this case, you got to think about the fact that he's now coming in with bulky adenopathy. So undoubtedly, when this individual was seen in the emergency room, people would have been very concerned looking at his retinal eye exam, why he was hemorrhaging, why he was complaining of nosebleeds and confusion. All this would have prompted a expanded workup by his ER doctors. And the tip-off here is that he had a very high total protein level. That's exactly what you expect to see in somebody who's got symptomatic hyperviscosity. Once those tips were in place, the workup initiated by hematologists would invariably have, included getting a CBC just to determine what the blood level counts were, getting a serum IgM because you would be thinking about Waldenström's and symptomatic hyperviscosity. You get a serum protein electrophoresis to see if this is a monoclonal protein. And you would get also CT scans because the exam would reveal that he had big lymph nodes, and you want to be able to get a better idea of how extensive the adenopathy is and how bulky it is. But the key thing here is a bone marrow biopsy. In order to make the diagnosis of Waldenström's, you want a bone marrow biopsy. You want to be able to look at the immunohistochemistry to understand that this is a B cell or lymphoplasmacytic cell entity. And you also would want to get molecular diagnostics while you're doing this bone marrow biopsy, just so you understand what the underlying genotype is for this patient. Does he have a MYD88 mutation? Does he have a CXCR4 mutation? Those are the two key mutations that we see in patients with Waldenström's macroglobulinemia.